We keep on trying to affect a solution. We try to work that in a very safe, calculated, well thought out way. So as a physician working with spine, you never know who's actually walking through the door. So when I have a patient come in, I'm always trying to assess, level of severity, history of the present complaint, try to get as much information as I possibly can to see if they're a good fit, first and foremost, of what I can do in my office. And they'll do a physical exam.
I think that's the normal way that things generally progress. And it's, I'm still not the person who's going to do a bigger surgery if ever needed on somebody too. So, but I am the person to say, I think this is much more serious than we all thought it was.
Every once in a while in my office, I have a very severe case that comes in that the patient might not be fully aware of what's going on. And when I order an image, I'll be able to identify exactly what's going on. And then from that point, I can make a decision. Do I start care? Yes or no? If I start care, does the benefits outweigh the risks? And if that's a yes, then I'll start care and I'll tell them, here's the limitations though. And if I think there are limitations that are outside of my scope of handling, I immediately refer them to Dr. Fallon for his opinion. And that usually looks like, hey, Dr. Fallon, I had this patient. Here's the image I have.
The spine is complex just in nature, even with the simple problems. We're looking at multiple vertebrae, we're looking at multiple different joints, even within one vertebrae. And then, there's plenty of confounding situations where maybe this isn't even your back, and so we've got to evaluate, is this something that, even if we were to help the back perfectly, will this even help the patient?
We actually share a portal. Well, not share a portal, but we have online access to the same patient image records. So he can see what I'm seeing on our computer screen, which is pretty awesome through radiology. And that's really accelerated our ability to quickly and efficiently collaborate on more extensive or more complicated cases. So if I have a patient who's a bit more complicated than what my office can handle, I'll send them to him. He'll do his evaluation. I ask, do whatever you think is in the best interest of the patient, where the benefits exceed the risks, and he'll do this thing. Of course, I trust him. And then we'll just talk back and forth. And
sometimes imaging can be really helpful, and sometimes it can also throw you because everybody's got some degree of degeneration going on in their back. And so you're making sure you're not just sticking with this idea that it's their back, that's the stuff I do. You're saying, well, at the end of the day, I'm a doctor, and I'm going to make sure that I'm giving you what you need to move forward with things. And so complexity, the spine is complex just to start. And then the idea that a lot of things that can happen in the body cause back pain, neck pain, all of these different pains. So you're making sure that this is something generally orthopedic and concerned where it's related to the spine. And that's an important point that I'm going after, really.
There's been a few instances where we had to put our heads together and we're both kind of scratching our head. I'm thinking like, I'm not quite sure where this pain's coming from, Doc. What do you think? He's like, I don't know either. So we keep on working the problem. We keep on trying to affect a solution, an OODA loop: observation, orientation, decision, action. We try to work that in a very safe, calculated, well thought out way that doesn't run on too long. And I don't ever try to have higher than normal expectations out of my care. I try to be realistic with myself. I know that I'm a physician, not a magician. So I understand my limitations. And when I have a patient that I think might exceed my limitation, I know where to send. And then Dr. Fallon will take it from there. He'll make a decision if it's something he can help. And if he can, he'll send on from there, which I trust him on that.
If it does get to the point where things either are too complex or it's to the point where something surgical is necessary, I'm in touch with my colleagues on the other end and making sure that I get them in as quick as I can. And I think those relationships I have are equally as important as this side, so that when I do need them, I can call them up and we can get them to the place they need to be at that point. So it's really having the network of people you trust is important, in knowing where you would go with people in certain situations, because sometimes you're not always the right person. But making sure that you know the resources around you is the really important part.